My dear students, please look at the topic staring at us and please justify its presence in MD Pathology University question paper. This artificial intelligence by itself is a discipline that is coming up, but in what form is it applicable to the medical and the pathological fields? And even then, to what extent can a student extend himself, particularly when it is the verge of the examination? I think that this will form an adequate introduction. We shall go to the definition. Machines that respond to stimulation consistent with the traditional responses from the humans, given the human capacity for contemplation, judgment, and intention. So this is called as artificial intelligence. These are nothing but fundamentally machines that have been given the instructions which are carried out for the benefit of humanity. Unlike the other machines, these can make decisions which require the level of a human expertise. So decision is the most important one. A little complex, but then I hope it is clear to us. Instructions have been given, chips have been inserted, and the machine acts. In short, if you can remember these two lines, it is enough. They are nothing but machines that could think autonomously. So this is called artificial intelligence. Please do not confuse artificial intelligence with robots. Alan Turing was the person who introduced this term, and he called them thinking machines, which are more or less equal to the human being level. And McCarthy was the person who reinforced that machines can think like human beings. Amazing concepts, wonderful, but then not from the examination point of view. I would like you people to kindly educate yourself on this, because tomorrow you are going to step into a world of automatism and digital pathology. These are my references. I would like you to go to these articles on the net. Now, what can be the impact of this? It is mainly intended to move the civilization in a forward and a progressive way. But without adequate safeguards, it can be destructive. And there can be an utopia being turned into a dystopia. What are these terms? That is why I said you have got a totally different set of words or literature, which is far away from pathology. Dystopia means it is an imagined state or society in which there is a great injustice that is being done. Somebody feels that there is a great injustice, and then he comes out and he tries to do enough justice or nullifies that. That is called as dystopia. And there is another word called as apocalypse, which means a total destruction of the world. So this is dystopia. I think the picture speaks for itself. You would have seen many a movie wherein somebody comes from the hero, most probably, and then he creates enough justice and the movie ends when he leaves. Apocalypse, a very famous movie. At the end of one, you find that there is a person who runs and tries to survive, save. It is nearly normal human biology. Whereas another one, he wants to make it extinct and destroy. Two opposite characters, very beautifully portrayed in the movie Apocalypse. This is one of the most important slides of my presentation. There are three qualities of artificial intelligence: intentionality, intelligence, adaptability. No abbreviations. These three words. Go back to my reference, you will be finding them. The intentionality is, what is your intention? To become a pathologist, to a doctor. And here, it is the power of the mind to be about something, to represent or stand for things. Sometimes it can be based on perceptions or beliefs. And they will be having a characteristic mark, psychologically or mentally. So that is the intentionality. That particular property I am going to infuse into a machine. LiDARs, use of light from radar. These all come under this intentionality. It can see objects, it has got sensors, and it has got instructions which will be able to deliver the goods. This is, for example, this is a driverless car, and we are finding a stream of these driverless vehicles which are maintaining the lane discipline, and there is a sensor in the front, behind, maybe above also, and then the lane discipline is being very well maintained, much better than the human beings. So its intention is safe travel. This is an extremely different one. We will be having a misconception that this is all artificial intelligence. In this case, just as any other machine, certain properties are being introduced or infused into the machine, which it can use to study the size, the density, the location, etc., and prepare an image out of it. It is not doing anything on its own, but it is a human brain that has created one. He has created something that is almost equal, but the problem is it can be fast, it can be precise, and it can happen in your absence. This is yet another example where it is being fused, but there is one stage ahead. There is a motor activity that is over there. Obviously, there can be a precise surgery. Whether this is going to replace the human surgeon is $1 million question. But definitely the sutures will be much more precise. The surgeries will be faster. Are they going to replace us? Let us see. What are the uses of these in general? Not only in the medical field, but anywhere. There can be a massive improvement in the storage system. Take my YouTube classes. Speed. There can be analysis. And there can be multiple directions of study called as algorithms. We all make choices, but in the end, our choices make us. A very wonderful saying. So ultimately, you have chosen pathology, but then later on in your life, it is pathology that is going to make you. Very simple. You just put your hand over there and you find that water is flushing out, you walk over. Sensors. These are machines intended for room adjustment. It facilitates washing. Also, you find that various other properties, locking a room, temperature, cooling, lighting, etc., can be taken care of by this system. Look at this one. The person walks in, and at a particular point, you would have seen this anywhere, in an airport or any place. The door, it gives way and you walk in. And the moment you go inside, the lights are on, the fan keeps running, the AC is on. And when you leave the room, everything comes to a halt. See how much it is being done. Now, leave alone the doctors being worried. Are the engineers being replaced? These are certain things called as pressurized cabins, a very favorite topic of mine taught by my geography teacher in my school. The human body is used to the pressure at the sea level. As you go higher up, you find that the pressure decreases. And obviously, there will be a flow of blood from your nostrils, the ears, and so on, rupture of the vessels can occur. But then, in the plane, you find that the cabins are made so that they have the pressure equivalent to the pressure at sea level, or there is only a gradual change. These are called as pressurized changes. And there are different sensors and other things that are motivating you. I do not understand any of these lines and other things. Probably you people are better. But this definitely you and I will be very good at. Many a time I see that there is no cash. An ATM machine. A machine that can read your card. It can identify. Go back to your number and favor you with cash. All in a short time. What are the uses and the risks of artificial intelligence? Lots of words will be there, but then I shall just pick up a few. You can read the rest. You find that the aim of artificial intelligence is to augment or improve the human performance. That is a fundamental property of it. But in some cases, you find this can be incomplete or it can even endanger humanity. Something wrong can be done. And certain mistakes will be repeated forever. This is a little complex for me also. But then look at this, an area of our specialty. There is a microsatellite, and then there is an error in the DNA. There is a mismatch within the cellular DNA. This is getting corrected, and ultimately you get a repaired normal cell. At the other end, you find that the mismatch in the DNA is not getting corrected. You get an unstable microsatellite region. Now, what will happen if one is a very intelligent person, but then he is disappointed in life? He creates defective cells, defective DNA, and then he infuses them into the cells or into the tissue of the patients. He is creating cancer. Rather than treating, he is creating. So that is the difference. So intention we have finished. The second important property is intelligence. This property of intelligence can be various things such as this. It can be learning by a machine, it can be the collection of a data, it can be a compilation, or it can be putting everything together. It can be used in various forms. Say, for example, the enrollment in schools, wherein they take the social, the economic, the lingual, racial characters, etc. And probably the students will be segregated or put together, and then they are trained in their own disciplines. This can be designed by the software. And in education, you find that ultimately it is not just one or two things. Here I am having an expert who will be able to teach me a bit of engineering about the global knowledge, maybe certain other things, and the library. It can be microscopy, even painting and arts, chemistry, etc. So is he replacing us? Time to ponder. The third important quality is adaptability. So these three things alone, you people will have to learn. So you will have to learn and will as adapt. So these are important things. So for example, the circumstances, the financial situations, the environment, the road conditions, military circumstances, and any new possibilities. Lots of plethora of circumstances where it can be applied. Transportation is one example. I had earlier shown you a picture of a few cars which are having a sensor and then no drivers. But then what will happen is when they learn and then implement, you are infusing the sensor just like your automatic machines, they are functioning. But then when they learn, what happens? And finally, is that performance going to be greater than man? This is the LiDAR. So they are radar induced driving. What happens is there is something wrong with this vehicle or this one, and it immediately not only stops or takes a diversion, it alerts the other vehicles. It talks like a human being, just like you showing your hand when there is going to be too much of a traffic or an emergency. So that it alerts there is a rim of safety that is built around it, and the others also take some diversion, etc. So this is a superb second level of intelligence. It not only follows, but it gives instructions. And in the medical field, there are lots of things which we are handling day in and day out without knowing. The sensors, automation, Sysmex, ELISA, histokinetics, recording, robotic surgery, and sometimes analyzing the vital signs, etc. So a lot of examples are there. And some of them are university questions for us. I shall be coming back to you people with the answers. Look at our friends. This is an age-old friend. In fact, the most loyal employee of a pathology department, the histokinetics. He works day in and day out and at night also. So there is a programmer and automatically there are changes. It is almost similar to a sensor, the time, etc. And this is another friend, the Sysmex or the automatic cell counter in hematology. So you just put in a sample, there is a suction and the rest of it has been programmed very well. There is a mixture of the blood and the fluid. Finally, you get the value within minutes. You can take a print or leave it as it is. And this is again an instance of a machine learning. In this case, you find that there are multiple wells of the ELISA. There are the various samples that are being put on it and finally being superimposed with an antibody, which can be coated or fluorescent. And there is a value that you get, a positive or a negative value. The report is ready and all the other things have been done. The timing, the mixture of it, and even the amount of quantum of the second fluid that should be added, everything has been done. And look at this. There is a beautiful probe over here. And once the sample is there, it is taken in and it is put into a well and it gets flushed and then it goes, it's ready for the second sample. All the wells are getting filled and then there is a process that goes on, a beautiful one. The bastion of biochemistry has been invaded by machines today. It can be any of these things. Not only so, when I talk about the applications, look at the MRI. Those days, the radiologists used to say, your eyes should penetrate the X-ray. And with the plain X-ray, they will be able to make a diagnosis. But today, they fed the details, the computer has retained it, it has analyzed it, and then you find that there are images at varying depths, different levels of thickness, based again on the size, the echoing, etc. So, MRI. Ultimately, you find that there are various pictures that are being captured. I am not an expert at it. In fact, I am not even a layman at it. But ultimately, what I could see is any of the images, it is being subject to a series of analysis, and ultimately they get an idea out of it, a logarithm that they have got. They make a diagnosis which is more or less correct. And a robo, it can be either constructive or destructive. Look at this one. It is building the walls. What many human beings cannot do, it keeps on doing. Or it can be destructive also, if it has been fed so. So almost everything has been brought down to the ground level. You must have seen many of this in the movies. And I would like you people to have your comments on this. So here again, there are certain images that have been fed. The robo is familiar with it, or the chips in it are familiar with it. It is also manually able to operate and adjust. So finally, it has got an image that is getting infused into its chips, which it develops, and probably it comes to a diagnosis. Whether this can be replaced by your eyes at the eyepieces, and what is behind your eyes, the brain that analyzes it, I cannot say. I once asked this question to a professor of radiology, but then that madam said, of course, it is very good in picking up the images and then doing everything, the MRI, etc. But then it is the radiologist who correlates with the clinical finding, with the surgical finding, looks at it, go back to the earlier pictures, again come back, makes a diagnosis, gives a differential, discusses with the pathologist, and finally they all come to a diagnosis. Deep Blue. This is one of my favorite person, and chess is one of my favorite games. Chess game is one. I used to call it as game because of gross and microscopy explained. Gary Kasparov. And look at this immense strength. He is able to combat multiple people through a simultaneous chess competition. But the same person here, he is combating a computer and he has got his hands on his head. There are instances where he bet the computer, but ultimately there was one where the IBM's Deep Blue, the computer bet him. So similarly, are we going to be replaced by these machines? $1 million question. So at the robo, what is there? There is precision, it is time program, there are attached gadgets to it, it can read the values, look at the graphs, etc. over here. And what can be lacking will be the empathy, the correlation with the patient, the surprises that can be there within the abdomen. The abdomen is supposed to be a temple of surprises. And finally, taking a decision accordingly. In which case, I feel that the human is still superior to this. And artificial intelligence and robotics. So these are all the various parameters which could be studied well by the robo and reported. And probably these can be also put into telemedicine, which is another topic to haunt us. So amazing. There is a robotic surgery, and then this is being seen by a person, maybe the vital signs, etc., to be reported, and it finishes off everything courtesy communal digital. And this digital has become my darling now, though I am zero. I'll have to learn a lot. The conclusion is, you find that there have been extraordinary advances in recent years. There is the incorporation of these three you people will have to remember: intentionality, intelligence, and adaptability. It can enhance human performances, but many of the pessimists say it is a doomsday, as in the movies. The ethics must be followed very seriously, and the means of remedy should not be confused with the harm. Thank you for your patient watching. I hope this class had been a challenging one for me, and I have given you a glimpse of this artificial intelligence. Kindly choose whatever you want and prepare a neat note of it, because it will consume a lot of time before the exam. Thank you once again.